Hello, John Kanalopoulos from our center here in Athens, Greece, the Laser Vision Arbitrary Surgery Center and Clinical Professor of Ophthalmology at NYU Medical School, New York City, New York. We're going to see a quite challenging keratoconus case. This is our 37-year-old gentleman. He has been fitted with gas-permeable contact lenses with which he sees brilliantly. More advanced keratoconus on the right eye and left eye. Advanced keratoconus, but surprisingly very good visual acuity. These are his measurements pre-op to us performing AthensProtocol on the right eye, which I need to note here was outside our normal specs because the minimal cornea thickness was 372. So very few people would attempt 372 cornea to be treated. Nevertheless, we went ahead and did our hyperopic technique, a technique where most of the treatment goes to the periphery of the cone and not the cone itself. This was our laser treatment on the epithelium, a CTaK, 40 microns, 7.5 millimeters diameter, and cross-linking 6 milliwatts per centimeter square for 15 minutes. And again, as a last resort, see here the auto refractions, minus 17, minus 8.5. And I think that nothing shows this better than the pre-ops. You can see the advanced keratoconus on anterior segment OCT, the epithelial maps invariably showing the remodeling of keratoconus and him now. And we can see the thinnest part of the cone does not translate to the thinnest part of the epithelium, which gives us the confirmation of stability, as does the deep, very deep CXL line that you can see here. And we can tell that the cornea has been drastically reshaped, but nothing tells the story better than if we look at his pre-ops. And we're looking here at steepest K over 70, almost 75 diopters. And currently the image, this was done end of September, we're mid-January, so we're about 3.5 months out. And this is the difference map, what we have achieved so far. You can see the drastic reshaping in the central part of the cornea. This part has flattened 11.5 diopters. This part has steepened 8 diopters. As a result, the cornea has really remodeled. And if we like to look at this in cornea symmetry terms, we can see that the IHD went from 217 to 162. Again, remember, we have very, very little space to work here, and we have a drastically improved cone. As a result, when best corrected visual acuity prior was 2100, we are now able to reach a 2040 with about 10 diopters of myopia and this drastic reshaping of the cornea. Again, before, after, and we can see here in today's clinical exams our typical ground glass appearance that a cornea cross-linked eye shows. Remember, we saw the anterior segment OCT showing the depth of the CXL line here and the epithelial remodeling. This is also from today. We can see the Vode striae right here, these vertical fine lines that are decimate level, but nevertheless a cornea that we expect through the year to improve. We may add some losartan to this cornea and will give us eventually with spectacle and soft contact lens correction at 2040, and with a scleral lens he cannot tolerate an RGP lens at 20/20 visual acuity. And again, this is a cornea that would have been transplanted. We would have removed the central cornea, and this 37-year-old gentleman will remain with his own cornea, fully functional, and we will entertain in the future the possibility of placing an ICL here in order to improve visual function. Again, tackling some of the most challenging keratoconus cases with our signature AthensProtocol, the combination of a topography guided reshaping of the cornea does not have to be necessarily myopic. I know this hurts mostly our US colleagues because the topo-guided software in the US cannot treat hyperopia, but outside the US, we can trick the numbers and treat hyperopic on this topography guided reshaping and affect the cone very, very, very minimally. This will create a higher myopic shift, but a cornea that's far more normal. And we're betting on the cross-linking, which synergistically flattens significantly the cornea to end up with an eye that's not as myopic as it was. And this is our result. We started with almost a minus 18 spherical equivalent, and we're now at a spherical equivalent of minus 12, despite the fact that we actually performed a hyperopic treatment. John Kanalopoulos from our center here in Athens, Greece. some very advanced assessment and treatment of advanced keratoconus. Thank you very much for your attention.